All right, you guys, big ups to reporter Kristen Hauberk for filling in for Elizabeth this afternoon. Kristen, it is time to thrive with Twin Cities Live.
That's right. Today we're helping you make sure you take care of the skin you're in. A possible result of not slathering on all that sunscreen is melanoma. According to the American Cancer Society, skin cancer is by far the most common of all cancers in the country. Get this, about 100,000 people will be diagnosed with melanoma just this year.
It's crazy. So Austin, Minnesota native and Dr. Sam Economou from the Minnesota Oncology Group joins us with new procedures and what we need to do to protect ourselves. So Doc, thanks so much for being here. Now,
my pleasure.
You are sort of a, as the kids would say, a one of one. Right? You do something as a plastic surgeon there that nobody else in this state does. What is it and why is it so important?
Well, I perform sentinel lymph node biopsies for melanoma, which is a crucial part of staging. And it completes the staging process, which then guides further treatment and surveillance.
Wow, and I think too, we were talking just before this, when you are going in and taking the melanoma out, other folks, not you, it's aggressive, and so they would get scarring, and if melanoma is on the face, that's a big deal. And so that's where you come in and have that expertise to help them not have that scar tissue and those lasting marks.
Absolutely, because what we do actually mimics in a lot of ways sometimes some of the cosmetic procedures that we perform. I mean, I try to place incisions in the same place where a facelift scar would be, and so that way it's more camouflage and less noticeable. But melanoma surgery is aggressive and leaves behind big scars.
Okay, so if you don't mind, you guys, can we show that other graphic again of the picture of what I think is the lymph node? Could you tell everybody what we're actually looking at here?
So that is an intraoperative view of the lymph node connected to a melanoma. And so when we do this procedure, I'm injecting a blue dye around the melanoma that then travels through the skin along the lymphatic vessels to the lymph node that connects to it. And then there's also a radioactive material injected that does the same thing. So that lymph node becomes radioactive and blue. And then I have a handheld Geiger counter, and that Geiger counter then guides me. I make an incision and then look for the blue.
That's fascinating.
Yeah, that is super fascinating. Now, when it comes to melanomas, which unfortunately you've said you've seen a rise in cases, and there's a lot of other reasons, and we can get into that. But what are some of the misconceptions about melanomas that you've found in your practice?
Well, I think one of the big ones is that patients get the diagnosis and they feel like it's a death sentence. That simply isn't the case. There's obviously a variety of stages. The earlier the stage, the better the outcomes without question, but also our treatments, even if patients have metastatic spread, are better today than they were even just 10 years ago. So there is hope and outcomes are dramatically improved.
Okay. When it comes,
Yeah, go ahead.
When it comes to the ABCs of our skin, what do you want us to keep in mind for that?
So it started as an ABC, but then it expanded now to A, B, C, D, E.
Oh gosh.
A is for asymmetry. So if you cut the mole in half and look at both halves, each should be equal. Then B is border. The borders should be regular. The above example under B shows irregularity in the border with some notches and extensions. C is color. A mole should be pretty equal in color throughout. If it's not, it should be checked. D is diameter. 5 millimeters is kind of considered the upper limit for moles. So that's the same diameter as a pencil eraser. So if it's bigger than that, a dermatologist should check it. And E is kind of the newest one, and that is evolving. So that's change in a mole over time. If it's changing, it should be checked.
Okay.
That's very helpful to see that visually.
Yes.
I know, that's a very helpful little graphic there, because basically we all know what a mole looks like. It's a very characteristic, stereotypical sort of blemish or little dot on your body. Now all of these, there's nothing pretty about those. It's basically, if you have a mark that's not symmetrical, looks clustery and sort of almost looks blistery.
And has changed over the years.
Yeah, and it's changed.
Get it checked out.
You got to get that thing looked out.
For sure. I mean, if you saw that on your body, you'd be worried about it. But unfortunately, there can be more subtle changes that aren't picked up. Melanoma can even fool dermatologists.
Really?
And so, unfortunately, the key is watching it, looking for change, and getting skin exams regularly.
Yeah, and I'm sure that your spouse or partner can probably help you with the places that you can't necessarily
Hey,
see.
you're back.
Absolutely.
I know. Yeah, that
Absolutely.
thing on your
Check
back
this
that
out.
you can't see, you might need to check that out.
Right.
So, what are the best ways? I'm assuming that sun exposure, tanning beds, UV light, that's the biggest culprit for this. So, how do we best protect ourselves, and what should we look for in sunscreens?
Well, there's a variety of ways to protect. Obviously, you can stay out of the sun. If you're at the beach, you can be under an umbrella and in the shade. Obviously, if you're not, then you should be wearing some protection of some sort. Sunblocks come in two forms. There's mineral blocks, and those use either a titanium or zinc as the protection. They are natural. They aren't absorbed by the body, and they're 100% blocked. So they're very effective.
And what would you say is the minimum SPF we should look for, that number?
Under a 30 isn't going to be very protective. Over a 50 doesn't provide that much statistical protection. So 30 to 50 is your sweet spot, and you should reapply every 2 hours.
Sure, or especially if the kiddos or whoever goes in the water.
In and out of the
right?
water.
I'm always
Yes,
like,
Right.
for
look at
sure.
that.
Right.
Always.
And I'm assuming that the sun is stronger certain parts of the day, so that 11 to maybe 4 or 5 o'clock is the
10 to 2 is the worst.
Is it really?
Yes. So that is the worst part of the day and the most dangerous, without question, with regards to UV exposure.
What would I say? What would you say if I'm like, yeah, but it's cloudy out?
A lot of people say that. Well, the bottom line is UV rays pass through the clouds.
Yeah.
So even though
So
we've
you're
had
still
cloudy and rainy
exposed.
weather,
You're
you
still
look out.
exposed.
Yeah.
Even in the winter, we're still getting UV rays.
Yeah, fascinating.
This
Great
is good stuff to keep in
Yeah.
mind.
Yeah, thanks for being here.
Thank you.
Very, very informative. So, to connect with more than the 100 cancer care experts at Minnesota Oncology, head to mnoncology.com.
Next.